قلت لها أنا. يعطيك العافية دكتورة.
أهلين، حياك الله. واضحة كذا السكرين عندكم؟
يعطيك العافية، بس تطولي لي على المايك من عندك شوية.
أوكي كذا تسمعيني؟
إيه بس شوية أعلى لأن الصوت ضعيف شوي.
طيب أجل خليني أجيب السماعة أفضل، إيش رأيك؟
ليش الصوت عندها واطي؟ ما أعطتني اللينك عشان أرسل على البنك. سوا أنت حنان تكلميها.
تجيب السماعة.
المايك عندش بالكمبيوتر.
ويمكن
تكلمي الحين، خليني أشوف.
استخدم المايك كذا أفضل.
لا تمام، مرة ممتاز، يعني إذا يريحك حتى بدون مايك الصوت مضبوط.
خلاص خلينا بالمايك أحسن على أساس بس يكون الصوت واضح للجميع.
خلاص تمام، معناها الحين إحنا قدامنا 12 دقيقة، نبى أرسل لك الدايركت لينك حق اليوتيوب على الواتساب الحين. فشربي لك ماي ولا كافي عندنا 10 دقائق.
تسلمين، شكرا جزيلا. الله
يسعدك يا رب.
تحتاجين شيء؟
If you just send it this بس خليه إنجليزي. we're gonna start soon. نحط اللينك حق اليوتيوب حق ذنين اللي أنا رسلت لهم سوا.
بس you already said it.
لا ما رسلت لهم بس بالإنجليزي ما كملت. خلاص ببدأ أروح هناك ماما. Thank you. Good evening, ladies and gentlemen. Welcome you all to such a special event with a special guest, Dr. Nada Al-Zaidi. We all thank her for accepting this invitation from Al-Amal conferences and exhibitions, which go along with the Musanidun for support mental health. It's such a great coincidence that come in September. September is the month of crisis awareness. For that, we should be aware of all mental health. And as we live in an era of pandemic, which is COVID-19, we should all raise the awareness and how to prepare ourselves and how to be strong and tough to face it and make it together. Though we are all thanks Allah and God that He make it such a beautiful or a good experience in a way. That's why we have to be positive and face it just to overcome any mental drawback. For that reason, we have such a great and special speaker, Dr. Nada. Dr. Nada, she's the consultant psychiatrist. She based in Saudi Arabia from Dammam, which is the east part of Saudi Arabia, as we have guests from around the globe. So we are just about trying to introduce how the geography of Saudi Arabia works. She's the head of the Department of Psychiatry in the Eastern province of Saudi Arabia, which is part of the Ministry of Health. Dr. Nada, she has the Arab board in psychiatry, as well she has a diploma in cognitive behavior therapy. On the top of that, she has a diploma in quality management and patient safety. Dr. Nada has a full CV full of achievement and success in her life. And for that, we're greeting her all and welcome. The floor is yours, Dr. Nada.
Thank you very much, Dr. Amal. يعطيك العافية. I will start sharing my screen. Is it clear to everybody?
Clear so far. So for Arabic and English speaker, please, this is just a quick announcement. If the sound is clear as well as the quality of the picture clear, you just type in the chat bar yes or no, because Dr. Nada is about to start. And if you are asking for a certificate or you have any questions, you can leave that all at the end, and just please kindly focus on her lecture. Thank you.
Thank you, Dr. Amal. I would like to thank Al-Amal Conferences and Jam'iyyat Musanidun for this kind invitation. I'm really honored to be with you tonight. I'll try to make my talk short so we can keep a few minutes for Q&A. My topic will be about COVID-19 and mental health. I'll be talking about psychology of pandemics, the social impact of COVID-19 pandemic on societies, the psychological impact of COVID-19 pandemic on individuals, and the World Health Organization, WHO recommendations, and then we will end up with the positive impact of COVID-19 pandemic. Just to learn about what's happening now, we need to learn from the history. And the most recent history of pandemic was on 1918, the Spanish flu H1N1 virus. So what happened at that time, the pandemic was severe, the most severe one in the recent history. It is estimated that about 500 million people, or 1/3 of the world's population, became infected with this virus, and the number of deaths was estimated to be at least 50 million worldwide, with about 675 occurring in the United States alone. Let's see the story of James. James is 96 years old. He vividly recalled the 1918 Spanish flu pandemic. At that time, he was 8 years old. The city had ground to halt. The schools and theaters were closed. The dance and other social gatherings were banned. James was not even allowed to go to the local playground because his father feared he would fall ill. The church services were banned despite protests from the clergy. James recalled the front room of the family home containing the bodies of his mother and younger sister. It all happened so quickly. People could fall sick in the morning and be dead by evening, and people were afraid to leave their homes. And this is how it looked like at that time. As we know that pandemics are large-scale epidemics that spread throughout the world, and the psychological factors are important for many reasons. They play a role in the non-adherence to vaccination and hygiene programs, and play an important role in how people cope with the threat of infection and associated losses. The psychological factors are important for understanding and managing the societal problems associated with pandemics, such as the spreading of excessive fear and stigmatization that occur when people are threatened with infection. We will come to it more when we talk about the psychological impact on individuals. And when threatened with infection, people vary widely in their reactions. Not every person is the same in their reactions during this threat. The complexity of their reactions need to be taken into consideration in order to understand the psychology of pandemics and to understand how and why every person is dealing with this pandemic or this infection in this specific way. As we know, pandemics are associated with a score of other psychological stressors, including the health threats to oneself and loved ones. We are afraid to get the infection or our loved ones. The severe disruptions of routines, especially when it came to quarantine. We couldn't go out, we couldn't do our exercises, we can't go to our families, beloved ones, we can't have our usual social gatherings, the separation from family and friends, shortage of food and medicine. Alhamdulillah, in Saudi Arabia, we didn't face this, but in lots of places in the world, they had this problem. The social isolation due to quarantine or other social distancing programs, the school closure, or what's happening now as our children are studying from a distance. The financial impact of the pandemic that can be severe enough and stressful as the infection itself. Some people lost their jobs or are threatened to lose even their jobs. So let's talk now about the social impact of COVID-19 pandemic. When they came back after the quarantine, this was their new normal, as they're telling us, this is our new normal now. They went back to their normal life, but still they were wearing not masks. Alhamdulillah, we have masks, but they had it in a new way and a new style. So the effects of global pandemics on societies. As we know, epidemics are crises. And during crisis, a lot of commonly held beliefs are questioned. Why is this happening? How did it happen? And the racist ideology is not surprising during any epidemic, but a serious threat to effective health responses. And as you know, this is framing about this particular pandemic when they call it Chinese virus or Wuhan virus. It leads to a great deal of stigma for anyone from China or of an Asian descent. And this is a huge movement of social time. What's happening now is either under intimacy or over intimacy. Under intimacy, we lost our social relationships. One of my friends was telling me, I started to lose my social skills. I don't know how to deal with people anymore. It's difficult for me to go back because we had a long time sitting alone, not going to social gatherings. So our social skills have been altered or affected. And there is also kind of conflict that will follow. And there is also, on the other hand, over intimacy in many relationships. As people are in their homes and interacting more with the family members, roommates, and also it will have consequences. As you heard, I'm sure, that there are many marital problems happen, the divorce rates increased during the quarantine time. The good thing is something we called human solidarity, الشعور الجمعي الإنساني. With this COVID-19 crisis, the humanity is facing one of the most serious and uncertain crises in the recent history. So what does solidarity means? It means that we are all in this together. This virus, it doesn't matter with the virus. Are you black or white? Are you Muslim or Christian? Whatever your race, whatever your color, whatever is your religion, we are only humans in this. We are facing this virus all as humans, regardless of any other means. And it was emphasized also by the United Nations Secretary General during the launch of COVID-19 Global Humanitarian Response Plan in March 2020. They said we must come to the aid of the ultra-vulnerable millions upon million of people. Alhamdulillah, we in Saudi Arabia, we didn't face this problem, but there are people who are not even able to protect themselves. And this is a matter of basic human solidarity, because if they get infected, we will also get infected. The spread will come to us. So it doesn't matter if you're poor or rich. At the end, we're all humans, we're all facing the same thing, and we all need to get the same vaccination, the same treatment, the same medication, and it's crucial for combating the virus. This is the moment to step up for the vulnerables. Now I'll be talking about the psychological impact of COVID-19 pandemic on the individuals. So what are the psychological impacts or the disorders that can happen? We can have acute panic attacks, anxieties, obsessive behaviors from washing hands or excessive cleaning, paranoia, where we think that, oh, this person is about to spread the virus, or he wants to get me infected. So some people can get paranoid towards others. Depression, of course, and post-traumatic stress disorder in the long run. Whoever faced any trauma during that time, especially in healthcare workers, when they see the dead people at that time, it might cause post-traumatic stress disorder in the long run. I'll just talk about anxiety because it's the most common. We are seeing a lot of cases in our clinic nowadays, and during the pandemic, while we had a virtual clinic through the phone, the anxiety levels were very high. And let's see why was this happening and why it is until now happening. As you know, anxiety is a normal reaction to uncertainty and things that may harm us. For many of us, the coronavirus and COVID-19 illness make for a very uncertain future. It's a virus that we don't know much about it, and we're having research now, and at the beginning of the COVID-19, there were many contradicting researches. At the beginning, they said it's droplet-borne infection. Then they said it's airborne. Wear the mask, don't wear the mask. Wear the gloves, don't wear gloves. So there were many conflicting messages that increased the uncertainty and increased the anxiety. People worry about their own health and the health of their loved ones, both here and abroad. So this is again another reason to provoke anxiety. People may also have a lot of concerns around school or work. Until now, people are struggling with their school process, the distance school processing, their finances, and other important parts of their lives. People who already experience anxiety, our patients who already have anxiety disorders, they might find even that their anxiety has been worsening. As we said, this is an anxiety-provoking and stressful time for everyone. So it's okay if you feel more anxious than usual. Don't say, don't get anxious. No, it's okay to feel anxious, but it's important to talk about it, to take time for yourself, to manage your own mental health. You cannot fix others while you are not okay. And just remind yourself that you're doing the best you can in a time when simply turning on the news can feel overwhelming. Let's go to the other extreme. While anxiety is a normal and expected reaction to the pandemic, if we say too much anxiety can start to cause harm. When anxiety and fear lead to panic, people may also take precautions that ultimately cause disruption in their life. Some people who will demand lots of tests, they want to go to the medical care or the hospitals while it's unnecessary. Or some people, as we saw in the news, when they went to the pharmacies or shopping and taking lots of things that they don't need and supplies that they don't need, and they left the sick people without those items. And again, there is the other hand, that anxiety can cause totally the opposite reaction. If some people, they deny or they refuse to believe the situation that is serious. The denial is unhelpful, of course, but it is anxiety. We see some people, especially in the beginning of the pandemics, no, there is nothing such as called corona. This is only conspiracy theory. It's nothing. They're not wearing masks. They're not trying to wash their hands. But actually, if you dig deep with those people, they are really anxious, but their coping strategy with their anxiety is just denying. It makes them feel more comfortable, because if they thought about it much, they will feel more anxious and they cannot really deal with this anxiety. So the best way for them is to deny. What happens with those special population of denial? When they deny the severity of a situation in order to avoid anxiety, they may do nothing, or they may ignore the public health orders or recommendations from the health authorities, so they may spread even the virus more. So how to deal with the uncertainty during the coronavirus pandemics? We as humans like to be in control of things. We like to plan, we like to organize, and we like to know what's going to happen. Even when we are in the plane, we like to know in which altitude are we, when are we going to reach the destination, if we are going through turbulence or not. We always like to know what's happening, even if it is out of our control. And what happened when the pandemic came, it has disrupted all of that. Humans also crave security, and the uncertainty can entangle one in uncountless what if. So what if happens so and so, and what if, and overthinking about the worst case scenarios, leading again to anxiety and stress. So can we avoid this uncertainty? Unfortunately, no, we cannot. But we need to learn how to cope with this uncertainty. How can we do that? Simply by focusing on controlling those things that are under your control. Don't try to control everything, because not everything is under control. Just focus on controlling the things that are under your control, and focus on the present. We like to plan, but again, just focus on what is in your hand now. Focus about today, about the short time, and challenge your need for certainty. Do we need to be certain about everything? Not everything in life is certain or taken for granted. Learning to accept uncertainty is not having, or it doesn't mean not having a plan. No, you still have a plan, but you will have plan A, plan B, plan C, and be flexible. I will just go and see what will happen. If plan A worked, okay. If not, I have to be flexible to work with plan B or C or other plans, and try to reduce your anxiety and stress levels. Some people do this by exercising, some people by meditating, by prayers, and it's always okay to reach out for help from friends, from mental health professionals. This is simply the 3 spheres of control. I will give a simple example. As you see, the red circle is what you can control, completely under your control. I decided to make a party, so I invited my guests, I set up the date, I called the restaurant, and I set up the menu, and I put the tables and chairs outside in the garden. It was beautiful weather on that day, as I assumed. So all of these things are 100% under my control. And then the orange circle or the yellow circle, I still can influence it, but it's not completely under my control. So after everything was set, it rained. So I can change things, but I cannot stop it from raining, right? So I decided to put some umbrellas. I took some of the chairs inside and some outside, and I tried to manage. But what happened outside of my control? An earthquake happened, or something really out of my control happened. This is where I shouldn't take control or bother myself or get myself overwhelmed about controlling things that are out of my control. These are the WHO recommendations, some tips to keep mentally healthy during COVID-19. Just pause, breathe, and reflect. Now we are almost at the end of the COVID-19 pandemic, so just reflect what happened, how strong you have been through all of this, what are the positive things you've done to yourself or to others, and reflect and give yourself the credit of what we've done. We are heroes, by the way. We survived this pandemic, so we are here. We need to give ourselves a credit. And we need to try to keep to a healthy routine. Lots of people, they stopped exercising during the pandemic. They ate lots of sugars. They gained weight during this pandemic. We shouldn't do that. We should go back to our healthy routines before the pandemic. We need to connect with others virtually, physically, by precautions, but we need to connect with people. We need to be kind to ourselves and to others. And as we said, search out for help if you need it. It's never a shame to search for help or to say that I need help. So let's talk about the positive impact, the good thing about COVID-19 pandemic. The skies are bluer. According to NASA satellites, they have documented significant reduction in air pollution, up to 20 to 30% in many cases, in major cities around the world. Fewer cars are crashing, fewer trauma-related admissions to hospital, and crime is falling. The pandemics also may lead to a public more willing to accept the public health messages. Everybody now is waiting for the MOH messages. What shall we do? How can we manage things? So now people are more willing to accept. Some other infectious diseases are fading from hospital emergency departments, and the hospitals has seen sharp decline in pediatric admissions for respiratory illness, maybe because children and families are taking advice on hand washing, personal hygiene, and other prevention measures seriously. So these are the positive side of COVID-19 pandemic. The last thing I want to talk about is reassessing priorities. Before the pandemics, we used to think that some things in our life are really a priority. We cannot live without it. I cannot live with this coffee from this specific place and this morning. I cannot fulfill my day without looking in the social media and seeing this snapper. What did she say and what is she wearing? After what happened to us, especially when we were in quarantine, we went back to the old life where we need only the basic things. We need food, we need safety, we need health, we need our close beloved ones just close to us. So if this was our hierarchy of priorities, work, family, health, home, relationship, friendship, hobbies, recreation, fun, self-care, personal growth, sports, spirituality, religion, money, volunteering, I think everybody had changed his or her priorities after this pandemic. And the good thing about it is that we are building our resilience. We all face trauma, adversity, and other stresses. And the COVID-19 let's look at it positively, that it's a roadmap for adapting to life-changing situation. Before, maybe we were more rigid, we cannot change anything in our lifestyle. I have to wake up in this time, I have to take my coffee from this place, I have to do my exercise at this time. And now, no, we are changing our life situation and emerging even stronger than before. I would like to thank you all for listening, and I'm ready to answer your questions. Thank you.
Thanks a lot, Dr. Nada, for such a wonderful, short, to the point webinar. Do you mind just a good gesture for some of the Arabic speakers, just to give them just about 2 lines about what is this lecture about? Because I think some of them, they struggle to understand, but they feel that it's something good coming out from your mouth and they would like to share it. Just about 2 lines, if you don't mind.
2 lines صعب, but I can just make it again very briefly in Arabic. I think I can do that. Just give me a few seconds. أنا أعتذر إني تكلمت بالإنجليزي، بس هذا كان البلان إنه إحنا المحاضرة باللغة الإنجليزية.
لكن they like it pretty much. إحنا we don't want.
خليني أشرح بس بعض الأشياء المهمة اللي ممكن تفيدهم بالعربي. طبعاا إحنا تكلمنا على الهيستوري الماضي أو التاريخ حق الإنفلونزا اللي هي 1918. تكلمنا على الوضع النفسي للبانديمكس عموما، لكن خليني أتكلم عن الأشياء اللي زي ما قلنا الشعور الجمعي. هذه كانت من الأشياء المهمة أو الأشياء البوزيتيف أو الأشياء الإيجابية في الكورونا فيروس. الأشياء النفسية اللي هي ممكن تجي للفرد أو التأثير النفسي للكورونا، ممكن هي حالات الاضطراب الفزع أو الهلع، القلق، السلوكيات الوسواسية كغسل اليدين، أو مثلا الخوف من أنه ممكن يجيني العدوى، أو حتى ممكن الشعور بالاضطهاد أنه ممكن هذا الشخص متعمد أنه يعديني أو متعمد أنه يأذيني. الاكتئاب طبعا، واضطراب كرب ما بعد الصدمة على المدى البعيد. طبعا زي ما قلنا تكلمت أنا أكثر شيء كان كلامي عن القلق، لأنه هي أكثر الحالات اللي قاعدين نشوفها خلال الكورونا فيروس أو ما بعد الكورونا، اللي هو القلق. والقلق ناتج عن عدم الإحساس بالأمان، أو إحنا مو فاهمين بالضبط إيش اللي قاعد يصير أو إيش اللي حيصير بعدين. والمشكلة إنه إحنا ممكن يجينا المرض، ممكن الناس اللي نحبهم يجيهم المرض، إيش اللي حيصير في مستقبل أولادنا، في الدراسة، في العمل، في الحالة المادية. في ناس طبعاً طلعوا من شركاتهم، في ناس فقدوا وظائفهم، فهذه الأشياء كلها تسببت في زيادة في القلق. طبعاً قلنا في ناس عندهم القلق طبيعي في مثل هذه الحالات، لكن القلق الزايد عن اللزوم مشكلة. والعدم القلق أو الناس اللي هم يوصل فيهم مرحلة إنه ما في ولا شيء، اللي هم ينكروا حدوث أي شيء، هم ما هم معناه إنه هم ناس مستهترين، بالعكس هم ناس قلقين أكثر مما يجب أو من اللازم. عشان كذا ما هم قادرين يواجهوا قلقهم، فالطريقة حقتهم للتأقلم مع هذا القلق الشديد إنهم ينكروا اللي يصير، وإنه ما في حاجة بتحصل. هذول الناس ممكن ما ياخذوا التطعيمات، ممكن ما يطعموا أولادهم، ممكن ما يهتموا بالسلامة أو بالإجراءات الوقائية اللي فرضتها وزارة الصحة. طبعاً اللي تكلمت عنه برضو في النهاية إنه إحنا كهيومنز أو كطبع الإنساني، إنه إحنا نحب نسوي كنترول على كل حاجة، نحب نخطط كل شيء، نحب نرتب كل شيء، نحب نعرف إيش حيصير بكرة، إيش حيصير بعد شهر، إيش حيصير بعد سنة، ونرتب لحياتنا. اللي حصل مع البانديميك أو مع الكورونا فيروس إنه هذا الشيء جاء لخبط كل شيء، جاء كركب لنا حياتنا. الأشياء اللي كنا معتقدين إنه هي خلاص حتمشي بالسيستم، هذا كل شيء فجأة تغير، وبدأت تصير عندنا اللي هي الانسرتينتي، اللي هي الريبة، إنه طب إيش لو صار كذا، وإيش لو صار كذا، وما نتخيل إلا أسوأ كيس سيناريو، ما نتخيل الأشياء العادية اللي ممكن تحصل. طبعاً هل ممكن نلغي الشيء هذا؟ ما نقدر نلغيه، لأنه الوضع إلى الآن قائم، إلى الآن ما انتهت الكورونا، إلى الآن الطيران مقفول، إلى الآن حتى أطفالنا ما راحوا للمدارس. الشيء اللي إحنا نقدر نسويه إنه نتعلم كيف نتأقلم مع هذا الشعور بالريبة. كيف؟ بأنه نعمل فوكس أو نركز على التركيز على الأشياء اللي في دائرة السيطرة حقتي، أركز على الحاضر اللي أنا فيه الآن، أتعلم إنه مو كل شيء لازم يكون تحت السيطرة. وهذه الدائرة اللي أنا حطيتها ال3 دوائر، الدائرة الحمراء هي 100% تحت سيطرتي. أنا اليوم قررت إني أنا ألبس اللون الفلاني، هذا 100% تحت السيطرة حقتي. الدائرة البرتقالية، والله أنا قررت أجي اليوم المحاضرة وأجي اليوم الزوم، لكن ما حد منكم جاء، ما راح أعطي المحاضرة لنفسي. فهذا الشيء بيدي ومو بيدي، أنا جيت لكن ممكن أنتم ما تجوا، ف50% عندي 50% عندكم. وفي شيء outside of my control، فجأة النت حقي طفى فصل ما أقدر أرجع أدخل مرة ثانية، هذا خارج نطاق السيطرة. فأنا أحاول أركز على الأشياء اللي داخل السيطرة حقتي. طبعا التوكل والأخذ بالأسباب، في الأخير أنا أتوكل على الله في كل شيء، بس في أشياء أقدر أخذ فيها الأسباب 100% وأقدر أسيطر عليها، وفي أشياء أحاول أسويها وممكن تجي على هوايا وممكن لا، وفي أشياء مهما حاولت إني أسوي فيها شيء ما راح تتغير. زي لما أكون مثلا في الطيارة وفجأة الطيارة تهز أو أدخل مثلا في تيربلنس، هل أقدر أغير شيء في مسار الطيارة؟ أنا ما أقدر أسوي شيء. فمن العبث أو من يعني عدم الحكمة إنه أنا أحاول أسوي سيطرة في الدائرة الزرقاء هذه اللي هي outside of control. وأغلب الأشياء في حياتنا على فكرة في الدائرة الزرقاء هذه، وإحنا نتوتر لأنه إحنا مو قادرين نسيطر عليها، وهي في الحقيقة خارج دائرة السيطرة. أنا أهم سلايد بالنسبة لي في المحاضرة كلها هذه، الواحد لو قدر يرتب حياته ويرتب تفكيره حسب الثلاث الدوائر هذه، مش بس في موضوع الكورونا، في كل مواضيع حياته، الحياة حتكون أفضل بكثير وحيكون فيها راحة بال. هذه اللي هي الريكومنديشنز أو التوصيات حقت منظمة الصحة العالمية، موجودة ممكن تلاقوها على النت. الآثار الإيجابية للكوفيد 19 إنه التلوث خف، الأجواء صارت أفضل، الأمراض المعدية الأخرى في المستشفيات قلت بشكل كثير، إنه الأطفال والأهل صاروا يهتموا أكثر بنظافة اليدين، بالإجراءات الوقائية بصورة أكبر. والشيء المهم الأخير إنه إحنا بدينا نعيد ترتيب أولوياتنا في الحياة. كان في أشياء إحنا نعتقد إنه هي من الأولويات، إنه أنا لازم أسافر كل شهر ولا أسافر كل 3 شهور ولا لازم أروح الويكند الفلاني في المكان هذا ولازم أشرب قهوتي من المكان الفلاني. اكتشفنا إنه هذه الأشياء كلها كماليات. لما جاء وقت الحجر اكتشفنا إنه فعلا من أصبح منكم آمنا في سربه معافى في بدنه معه قوت يومه فكأنما حيزت له الدنيا. في الأخير رجعنا للأشياء البيسك، الأشياء الأساسية. نبغى يكون عندنا مأمن، يكون عندنا مكان سيف ننام فيه بصحتنا وعافيتنا، حولنا الناس اللي يحبونا، and that's it. الأشياء الثانية اكتشفنا إنها تجي رقم 2 أو رقم 3. فكلنا أنا أعتقد إنه الكل رجع عاد أولوياته بعد الأزمة هذه، وإنه هذا الشيء خلانا بالعكس نكون أقوى، وخلانا نتعلم كيف نكون مرنين أكثر، بدل ما نكون خلاص رجد أنا لازم أمشي بالطريقة الفلانية هذه، لازم أتعامل مع الأمور بالطريقة الرجد هذه. الآن صارت بالعكس، خلتنا نصير أقوى وأفضل من قبل. أتمنى أكون اختصرتها بشكل بسيط وعذروني.
You did really very well. Thanks a lot. I just asked for a quick summary and you went through all over again. It's highly appreciated. Thanks a lot for such a wonderful talk. And we are welcoming any question coming from our people, either from who watching us through the Zoom or YouTube channel. Dr. Nada, we have a question here saying, does the psychological impacts varies among people? Does if they have a systemic disease, does that have influence, or all will absorb the pandemic all the same?
طبعا هي لها جانبين، او جاب بالعربي ولا بالانجليزي الحين؟
I'm going in English, just
in English. Okay, sure. طبعا it has 2 parts. If the person has already previous anxiety disorders or anxiety problems, of course, as we said, it will provoke his anxiety or her anxiety more. And lots of our patients who were already on medication for anxiety, we had to increase their doses or add other medications for them. Having a systemic problem or a medical problem during the pandemic has 2 problems again. It might increase the anxiety itself by having the problem, or it can jeopardize them or make them more prone to have infections, because as we know, the coronavirus will come more to the people who are immunocompromised or have any other comorbidities or comorbid problems. So it will again escalate their anxiety more and provoke their anxiety more. So yes.
So when we come to the children, it seems based on the statistic, children and elderly people, they are most vulnerable mentally out of this pandemic. Is it something to do with their age, or is it just purely their perception, so they lack understanding of the problem itself?
As you said, they are more prone first, and let me start with the children. The children, they don't really understand what's going on. All of a sudden, they had to wash their hands every now and then. They're seeing people dying. Sometimes the fear and the anxiety of the parents will affect the children. They don't know what's going on. And Sometimes the reaction will be exaggerated from the parents, so they will not understand what's going on. We need to educate them, of course. We need to tell them that this is a different situation, that you need to take precautions, and they need to reflect and talk about their experiences. It's very unhealthy and unhelpful to tell them, don't do this, just everything will be okay, don't be afraid. Don't try to give them advices. It's not helpful. What's helpful usually for those children is to let them talk about their fears, to just speak about their experiences. So tell me, how do you feel about this? Now reflect what happened during the quarantine. What was the best thing that happened at that day? And what was the most thing that caused fear? So it's better for them to talk about their feelings and about their fears. Some children, maybe they cannot really express themselves. They can do it by drawing, they can do it by telling stories, but they have to really get it out of their minds. On the other hand, for the elderly, especially who have cognitive impairment, some memory problems, those are again vulnerable, and they're considered as special populations because they will forget simply. They will forget simply to wear their mask. They will forget that there is even a coronavirus. They will be more anxious, more stressed out. So again, you need to tell them about it without frightening them, remind them that this is something serious, but it will be resolved, and there is a vaccine coming on the way, that if you took the precaution, you will be healthy. We need to take care of their health and their mental status.
And if there is any recommendation for like a specific exercises which is help the family work together to overcome any mental like stress during this pandemic?
As we said, talking about it, sharing the feelings is very important. And this is something we don't really experience a lot in our Arab culture. Everybody will just be afraid alone, will be sad alone, will cry alone. We need to get together in these emotional states. And if somebody needs really help, we'll approach the family. What usually happens, I'll tell you, when a lady comes to my clinic, she said, I don't want my husband to know. And when a man comes to me, he said, I don't want my children to know. And when a girl's come to me, she said, I don't want my sister to know. So really, it's a problem. The social support and the family support is very important. When somebody knows that they have a problem, they may all of them have the same problem, but nobody is talking. Everybody is afraid maybe to hurt the others, or to share, or to talk about his feelings. So talking together, sharing the feeling together is very important. Getting connected with themselves in the family itself and outside also, it's very healthy.
And this is maybe part of what you just discussed about it's a human solidarity, but it's just around like a small circle within the family itself.
Yes, it's true.
Nowadays, like the sun is shining and it's rise up in the sky, and the cases is lower and reduced in number. So as you in the practice, have you noticed decline in the cases?
Psychiatry, no, it's increasing. The coronavirus cases are going down, the psychiatric cases are going up. And we were expecting this to happen because the psychological impact was very severe. The anxiety rates were very high. The clinics were closed. We used to do only virtual clinic, and some people couldn't really have the access to these virtual clinic. So no, we're having lots of patients now, and they're, all of the psychological impact is coming to the surface now.
Oh, okay. So do you think a number of this big or a huge number of patients because they were out of reach, or this not a big number of patients because of the outcome or drawback of the pandemic itself?
Yeah, it is drawback. It is the psychological impact. It's like something that accumulated throughout this period. The people with the OCD, for example, and they were already afraid of germs or having germophobia, washing and cleaning. Now it's like reinforcing their idea. See, I was right when I was washing my hands every now and then, when I was cleaning everything. So it reinforced even their wrong behaviors. Now they're doing these things and they're approved by everybody.
Though it's a show, it's not just about like being infectious with COVID-19 or the coronavirus, but medically it's proven it's a stress is like a big co-factor in having the disease itself. Does that apply to COVID-19?
It affects the immunity, and don't forget the long quarantine periods, Ramadan, Eid, Al-Hajj, all of these events were supposed to be happy events for us. Unfortunately, this year it wasn't. So all of these things caused, I will not say depressive symptoms, but at least symptoms of depression, especially for the old people who didn't see their kids, they didn't see their daughters, their granddaughters, their grandchildren. It was not easy for them. And it's not easy for them even to go back to their usual habits. Some people used to exercise. Now they said, I cannot, after the quarantine, I can't go back, for example, to my routine or to my usual habits. So there is a change. We cannot just ignore and say, no, nothing happened. No, there is an impact, physiologically and psychologically.
Do you think, hopefully, after, inshallah, everything gonna go back to normal, hopefully soon, do you think that the people will gonna recover mentally quickly, or it's gonna take some time? Because the pandemic apparently it takes time, like we're nearly like 7-8 months since it started. So do you think they're gonna recover soon, or is it gonna take them like long to be back to
honestly, I don't have an answer, because we don't know even when the pandemic will resolve, and we don't know when the vaccine will come, and still we cannot just predict. It's very difficult to predict, and these things we will know the results after we do studies later on. We now have studies during the pandemic, but we don't know what will happen after the pandemic, and you might be surprised. You never know what will happen.
Yeah, it's all about uncertainty. It's just a new era, is it?
Sure.
So you talked about like the behavior of the people. It's varies. Some of them, they were under intimacy, and the other side of it, they are over intimacy. This is something to do with the way they raise up, or it's a part of their culture, or it just has no like reason behind it?
No, it just happened that they found themselves all together at home, not going out. I mean, it just happened that they became more intimate, just facing each other every day. I heard one of the recommendations from a colleague. He said, you don't have to sit with your wife 24/7, because otherwise problems will occur. So again, just have your usual routine, even if you were inside the house. Go into your room and stay alone, even for the wife, just facing her children 24/7. It was really difficult situation. So we had to be there. It's not something that we chose. It doesn't have to do anything with our culture or our upbringing. It just happened. The quarantine forced us to have over intimacy with our spouses or with our children, and under intimacy with the social surroundings, because we were not going out. So we were forced to do this. And it all has consequences, under intimacy and over intimacy.
As you say, the incidence of divorce increase, and when the quarantines just offer some of the ladies all over, they start like celebrating their divorce day. Do you think it's just purely because the quarantine and just being next to each other all the time, or there is just accumulative and it's just a coincidence?
Wallahi, honestly, I don't know the answer. I just read it in the news. I saw the statistics had increased, but what are the reasons behind it? There was nothing done as a research or study. I just saw the numbers that obviously it increased.
As you are expertise, ladies and doctor, in especially around this pandemic, and we were working, so we didn't have quarantine apparently. So what's a kind of advice you give, because some of the listeners, they are either women, men, or they are like just couples. What advice do you give them through this period?
try to go back to your routine as early as possible. The healthy things, I mean, the exercising, the healthy diet, and reassessing the priorities. I think it's the most important thing that we need to do. We used to take many things for granted. We used to do many things and think that we cannot live without it. Let's just, again, reconsider our lifestyle, reconsider our priorities, reconsider our morals. What are the things that we really can let go, and what are the things that we really have to keep? What is most important? My family or my job, my children or the money, or, I mean, lots of things have been changed. I mean, on the mental level. So what's more important? Let's just reflect what happened and see what's more important to us, and things will just come. Everybody is different. Everybody has different priorities and different circumstances. So just sit back and reflect and reassess your priorities. This is my advice.
As you said earlier, there is a bright side of having COVID-19, like the pollution is less, and even our spending is much less, and we have time together as a family. So do you think when you sit with your patient and you prioritize the less to them, did they have that positive understanding of the changes? Or it's like sometimes it's hard to accept?
Well, we try. What we do in psychiatry or in therapy, we just guide the patient or the person that there is a bright side. I cannot force him and take his hand from the dark side to the bright side. What we do is guided discovery. We let them discover this thing with themselves. It's like just like lighting a flashlight for them and telling, see, there is a bright side over there, or there is another road over there. And we help them how to reach and go. But we don't force them. You cannot force anybody to choose something that they don't want.
No, definitely. But you are guys like who doing this hard job. You have like your patients, and I think you like spend hours and hours, and you raise their awareness in a clever way.
Yes.
So you have your own way.
We do our best, but we're not magicians, you know, at the end.
Yeah, you are not like magician, but you do your best, and I'm sure you are successful. Okay, Dr. Nada, this is your first time in here, I mean, around the community. Can you tell us about your journey with this special discipline? I mean, psychiatry and psychology, and choosing this as a specialty?
I wasn't ready for this question, but so the answer is simple. Psychiatry is my passion. I decided to be a psychiatrist when I was in the 5th year of medical school. I said, this is what I want to be. When I went to medical school, I wanted to be a cardiologist because my father had a heart attack when I was in high school. So I decided to be a cardiologist. When I went into medical school, I saw that most of the specialties, they don't know the names of their patients. So it was very frustrating for me, especially surgeons, no offense to anybody, but surgeons, they just see what's inside the body. They don't see the faces of the patients. They don't even know their names. To me, it was very harsh. So when I went to the psychiatry rotation, I said, yes, this is where I want to be. Dealing with the souls, dealing with the minds. It's a challenge. You don't have a stethoscope. You don't have a special imaging or a special test to know your diagnosis. You need to use your thinking, your reasoning, and engaging yourself with the patient emotionally, being empathic, putting yourself in the patient's shoes. It's not easy, but it's something that I like. And alhamdulillah, I'm successful at.
Yeah, you are. Thanks for God, we have you in that discipline though. Do you advise the fresh graduate to go to it?
If you have the passion, yes. If you like psychiatry, because not every psychiatrist is a successful psychiatrist. And not every patient will go back to you if you are not really genuine. You have to be genuine. You have to really like it and be genuine at it. When you fake it, people will feel it. They will know that you're just doing it for money or just doing it because it's, some people, they think it's an easy specialty. You don't have long on calls, you don't go to OR, you don't have lots of, trouble at night. But if you're not really genuine, you cannot do it. So if you like it, yes, I highly recommend.
Oh, that's good. It's well known, though among a specific culture is more like a shame and a stigma to go to the psychiatrist, as you mentioned earlier. How do you find that in here in like Saudi Arabia?
Stigma is all over the world. It's not only in Saudi Arabia. I'll just tell you, in 2002, I worked as a GP for 3 years before I joined the psychiatry program. So it was like 18 years back. When I wanted to refer a patient to psychiatry, it was like, I'm saying a really bad thing to them and they get angry with me. Why are you referring me to psychiatry? Do you think I'm crazy? Now we are receiving referrals from the primary care. People are asking to be referred to psychiatry. So the awareness is better. The awareness is more. People are asking and seeking for help. I'm not telling you the stigma is resolved. We don't have stigma anymore. It's still there, but it's much, much less than before because the awareness has been raised.
Do you think because the younger generation have a better awareness, or it just like the...
Yeah, but still, I'm not talking only about the young generation. Even the older ones are asking for psychiatry referrals. They are suffering for like 20 years, 30 years from depression, from anxiety, from obsessions. And yet they said, no, it's time that I want to come to a psychiatrist.
Is it because
last year, every year in October, we have our World Health Mental Awareness Day. And every year they have a theme. So last year's theme was about suicide. And it was, a challenge for us to talk about suicide in the community. It wasn't easy to talk about suicide because we're a Muslim society. Nobody will commit suicide. It's a crime in our law. Yet it was very well taken by the community. And we talked about it. We had many conferences. We had many campaigns all about suicide. And it was really important to talk about it. So things are changing, alhamdulillah, to a better way.
Oh, alhamdulillah. Thanks a lot, Dr. Nada. It's all of our guests. Give a special thank you from around the globe, from ourselves, from Musanidun. Thanks a lot for coming and thanks for accepting the invitation. And it was such a wonderful webinar full of knowledge and information. Thanks for everyone. And I'm sure we're going to have a similar thing in Arabic in another time, but this time for English speaker, which is, I think it's a very good opportunity. Thanks a lot. Thank you.
شكرا.
Allah يسعدك. If there is any final word you would like to say?
I just would like to thank you for inviting me, to give me this opportunity to meet all of you, and I hope, inshallah, I'll meet you soon.
We're going to meet soon, hopefully. Thanks a lot. Thank you.
Yeah,
have a wonderful night. Thanks, everyone.